Good morning. My name is Mary McNamara, and I serve as the Director of Aging for the City of Cleveland and for Mayor Bibb. And I bring greetings from Mayor Bibb today. He's not able to join us, but thankfully he'll be able to tune into our program because our colleagues at TV20 are recording our entire program today. So he, along with many other members in our community, will be able to learn about the resources we're sharing today. So again, I want to thank Mellow Thunder for performing, and I want to particularly highlight Tony Dial. The lead singer has been a longtime employee of the Department of Aging and brings so much to our team in addition to his musical talent. So thank you. So today marks our 17th annual Disability Awareness Day celebration, where we celebrate all abilities. A couple of housekeeping notes. First, please keep enjoying your lunch. If you need a second drink, head right out this door. Also out this door to the right is the restrooms. And as you approach our registration table, that's where you'll turn left for the restrooms. The lunch today was provided by a small Cleveland business called Bistro North Point downtown. So we hope you enjoyed it as much as we have. If you need any assistance today, please look for any Department of Aging employee. We sort of stand out. We've got these bright orange t-shirts on from this year's Summer Senior Walk. I want to thank our interpreters from our partners at Cleveland Hearing and Speech, and also want to thank Denise Munguia of Court Reporting and Captioning, who's providing that service today. Is this anyone's first time here at Benjamin Rose? Good, welcome. They have been providing services for more than 115 years to older adults in our community, to both older adults and the caregivers they provide, or the caregivers that serve them. I also just want to acknowledge that we are proud to be part of our network's Aging and Disability Resource Network. It's a 5-county network that provides services to adults with disabilities and individuals 60 years of age and older. This network is supported by the Western Reserve Area Agency on Aging. Do we have anyone from the AAA here today? Thank you. So myself, the Cuyahoga County, LEAP, other agencies are part of the ADRC. We're grateful for your support and glad to have you here today. We're also glad to have so many partners in the room, and I won't be able to list them all, but a couple of shout outs. First, to some of the leadership of the city's EMS team in the back, if you could raise your hand. We're really grateful to have EMS with us. Our first responders, when they saw today's topic, they knew they wanted to be here. Also really glad to have our partners from Cuyahoga County Senior and Adult Services, right there in the middle, if you could raise your hand. One of the things we're hoping today is, while we've got a full agenda, we hope you get connected to each other. So whether it's the area agency, whether it's LEAP, whether it's the other agencies of NOCTO, whether it's EMS, we hope you get connected to resources. We're also really pleased to have an intergenerational crowd today. And you may have noticed up front, we've got a group of scholars from Councilman Conwell's ward, Ward 9, Mary McLeod Bethune School. And we're delighted a group of scholars and their teacher are here with us today. So glad you're joining us. I want to invite at this time Councilman Conwell up to offer greetings as well before we begin our program. Then we'll let you eat your lunch, Councilman. But more than 20 years ago, Councilman Conwell approached the Department of Aging director at that point, Jane Fumick, and asked, in addition to Senior Day, could we also have a day recognizing the abilities of all people? And it was Councilman Conwell's idea, and so we're so glad he could join us today. He's always representing Glenville, so he's got his sweatshirt on.
Top letters, you know.
And so before we begin our program, I'll let Councilman Conwell offer some greetings.
You know, Councilmember Pruitt, how you doing? Once a councilman is always a councilman, and you have helped me write on many legislation dealing with people with disabilities and We believe in the ability and not the disability. He was my colleague. Stand up. Stand up. It was good to see you. Good to see you. Yeah. I was looking at 311 legislation the other day, and guess who's on the 311 legislation? They helped me to sponsor it. Councilmember Pruitt. It was him on there with 311 legislation also. That legislation shows history, which is very, very important. So you on there with me. I looked and I smiled and I said, Young Pruitt, Young Pruitt. We believe in the ability and not the disabilities, and so we push legislation. So even when I'm gone from council, just like you, Councilman Pruitt, it will continue to be everlasting. What I'm working on now, and I'm doing the work welcoming, I'm meeting with Kate Borders. She's the new person over University Circle, Inc. And what we're looking to do is bring in, and I'm going to reach out to you also, the providers for people with disabilities. And then we're going to look to try to get them into places like Natural History Museum, the Arts Museum, to open that up, University Circle, Inc., Botanical Gardens, so that we can open this up and start doing job placement and job development for people with disabilities, any kind of disabilities. So after the election, probably sometime in December, Councilman Pruitt, because I got to go to National League of Cities. When I come back, then it's Thanksgiving, and then the 1st of December, we're going to bring you in, the leaders, and so that we can open up the Arts Museum and all of that, because we should be there too. People with disabilities, we believe in the abilities and not the disabilities. And that's important for you to be there. All that institution that you see that's back there should be open to you. Over there, even where the hearing and speech, where you guys are at, you gotta put people to work. Work is therapeutic, when you're there working. And you gotta believe in the power of work. And we have to, we're here having a luncheon, so what are the outcome measures? I gotta push that. I have to push that. And we'll have job coaches there, and then later on, you have greeters and the whole 9 yards. I talked with Matt at the City of Cleveland because I wanna bring in at the City of Cleveland to open that up also, so that when you see whatever, to have anything with physical or mental disabilities or whatever in the City of Cleveland. What Matt told me, we got to work through it because of the issues, and I believe in with dealing with the unions also. We got to make it fit in their right, but we got to have that. You got to have that power of work, and it's therapeutic, and it will make people, even with dealing with any kind of disabilities, you walk differently. And that gotta be open. And God laid that on my heart to open up University Circle. And how the councilman can do it, because I've been a council member of University Circle forever. And a lot of the legislation that goes to University Circle flows to this council member, and I have to represent us here. I have to do that and open it up for us. So I'll reach out to you, Mary McInerney. We'll have the discussion with Kate Borders, even down at City Hall or in University Circle. Might be better at University Circle, at Western Reserve Society, and then we'll talk and discuss how to get us in there. Because we got to have outcome measures. Luncheons is cool beans, man, but you have the outcome measures and believing in the ability and not the disability is first thing first. I'm going to grab a little lunch, and I'm not like I'm disinterested. Tuesday is I don't want to get into political stuff, but I'm out here campaigning. Councilman, I got to do what I got to do. This coming up, and I gotta work, man. We knocking on doors. My assistant is with me, and I got a crew. And I was up knocking on doors this morning on the west side, and I gotta knock on doors. I gotta push it. They gotta see me out there working, pushing, and I can't get into the political approach because we're in the government approach right now. But you know where I'm at, and you got to tell your friends and family and friends they got to get out there to vote, and that's very, very important. And you got to believe in the power of vote as well. So thank you and God bless. Have a good day.
Thank you, Councilman Conwell. For those that don't know, Councilman Conwell is one of 17 city council members. He represents Ward 9, which is the Glenville neighborhood.
I can't say this.
Okay,
We need people to vote for issue 49 for the children.
for the scholars.
Yeah, for the start. And I can't say this. Issue 55 for the arts. I can discuss issues in a government forum, not the political approach, but we need that 49. You see the babies over here? Children have to see success every single day, and they gotta see us working for them. And this is my school over here, Mary McLeod Bethune. Great lady she was, gotta study her history. Issue 49, issue 55, please.
Thank you, Councilman. This event would not be possible without a team of champions at the Department of Aging, and I just want to particularly highlight three of them. Adam Sisler, Mara Lane, and Nicole Barkley, who helped lead this planning for this event. And really, this event would not be possible if not for Mara. She suggested this year's topic, and this topic is important 365 days a year, but one even more relevant as we approach Veterans Day in less than 2 weeks. And as I thought about a moderator for this event, I thought it was really important to have someone who had firsthand experience with veterans. And so I reached out to my colleague, Terrell Pruitt at the city. And as always, when I call him, whether it's about a senior who needs extra help with removing trash cans, or from a senior who has a hoarding disorder and needs help with a lot of trash pickup, his answer is always yes. And so when I called him for this event today, the answer was just one short, I'll be there. And so I want to tell you a little bit about him because he's today's moderator and he'll introduce our panel. Terrell Pruitt he's a lieutenant colonel, serves also as the Commissioner of Waste in the Department of Public Works, and he's done that since November of 2018. As Councilman Conwell mentioned, he also served on Cleveland City Council from 2008 to 2017, and he represented the Lee Harvard, Lee Seville, and Mount Pleasant neighborhoods. In that role, he was the Majority Whip of City Council. He was also the chairperson of the Public Utilities Committee and the Operations and Personnel Committees during his tenure, and also served on multiple other committees. He is a lieutenant colonel in the Army National Guard and currently serves as the commander of the 1-147 Engineer Battalion. He started his career as a company commander, working his way up the ranks to become a brigade engineer planner, battalion planner, assistant operations officer, civil military affairs officer, brigade engineer, and finally, real property officer. He received a bachelor's degree in political science and a master of business administration in global business economics from Cleveland State University, and he was a graduate of the 2014 class of Leadership Cleveland. He will be moderating today's panel with an esteemed group of guests, and we hope that you learn as much as we have just in engaging with them. And so at this point, I invite Terrell Pruitt to the stage. Thank you.
Well, good afternoon. And that was a kind introduction. It was also a pleasure to see my colleague, Councilman Kevin Conwell. He's always an inspiration. He always brings important information from the community. He always stays very connected. I'm joined here with members from the Division of Waste when they heard about today's event. So they want to come out because they also are the individuals who also serve the citizens of Cleveland. So I want to recognize them. Would you stand up and raise your hand? This afternoon, we're joined by some outstanding panelists, and I'm going to take the time and read each of their bio. And after I complete their bio, I ask them to join me on the stage as we begin our panel discussion. The first person, her name is DeAndrea D, as her nickname, McDonald. She's a dedicated disabled Navy veteran and former electrician's mate who proudly served the U.S. Navy. She has over 15 years of experience working with the state of Ohio. She has made significant impacts in disabled veterans outreach. In this role as the program specialist, she's passionate about helping fellow veterans overcome barriers to employment and achieving their career goals. Her commitment to her brothers and sisters in arms is evident in her work, where she utilizes her military background to provide tailored support and resources. She's aware that the Department of Veterans program year of the year, she was awarded the Department of Veterans Programs year in the state of Ohio 2024. Outside of her professional life, DeAndrea enjoys engaging with the veterans community, advocating for their needs, celebrating their successes, and she believes in the power of resilience and importance of giving back to those who serve. Please join me on the stage. Our next panelist, his name is John Reese. He was selected as Executive Director of the Cuyahoga County Veterans Commission Service in October 28, 2013. He began his military service at age 17 by joining the U.S. Army Reserves while he was still in high school. After 4 years of college, and he participated in the ROTC program, he served over 5 years on active duty as a Signal Corps officer. After he left the Army, he has served over 2 years in intake and admissions coordinator at the Wade Park Veterans Domicile. He was responsible for outreach operations, processing all administration for homeless veterans. John's service to the veterans community extends beyond his position as the Veterans Service Commission. John is also the co-chair of the Northeast Ohio Veterans Community Task Force. John serves on the advisory board for the Greater Cleveland Fisher House, the Cuyahoga County Veterans Treatment Court, and the Westside Vet Center. John's education includes a bachelor's in information systems from the University of Toledo. He has a master's certificate in nonprofit management and a master's of public administration from Cleveland State University, as well as a master's of political management from George Washington University. Please join me on the stage, John Reese. Our third panelist, her name is Rhonda Spicer. Ms. Spicer, she serves as Assistant Chief of Social Work Service at the VA healthcare system. She has over 25 years of experience as a licensed independent social worker and has spent 15 years at the Veterans Health Administration. She oversees multiple programs, including caregiver support, home and community-based care, primary social work, as well as inpatient and specialist social work services. She holds a master's degree in clinical social work from the Ohio State University and an undergraduate degree from social work from the University of Dayton. Rhonda spent the majority of her career working with patients with advanced age, as well as those who experience disabilities from complex medical conditions. Please join me on the stage, Ms. Spicer. Our final panelist is Daniel Wiggins. Dan started his career with the Ohio Job Services, now called the Ohio Department of Job and Family Services, in 1977. As a disabled veteran outreach specialist, he was assisted disabled and other veterans who have significant barriers to employment. In his long 40-year career as a veteran outreach worker, in the vocational rehabilitation, Dan worked at the Federal Building, both for the East and West Side Veteran Centers, Volunteers of America Veterans Resource Center, Luther Metro Ministries, the Lakeside Homeless Shelter, and eventually ending at the VA Medical Center, Domiciliary, in 2018. Please join us on the stage, Mr. Wiggins. Okay, panelists, we have some very hard-hitting questions, so I'm going to throw out some of the hard ones first. Today is October 30th. Tomorrow is the 31st of October. What is your favorite Halloween candy?
All right. Well, I'm a whole diabetic, so I'm not supposed to eat candy, but if I could, it would definitely be Snickers and Twix. That would be my favorite.
Anybody else like to share?
Lemon heads, probably showing my age, but
Love Snickers, but I don't eat them.
This is the weirdest answer in the room, probably, but I'm a Tootsie Roll guy, so.
Long as there's no candy corn. Do we have any candy corn friends in the building? Okay. Oh, well, we all can be unique, you know. right, exactly. Thank you. All right. So as we get into the meat of our discussion, first thing I will ask each one of you to do is please tell us about your service in the military and how you came to your career right now. I'll start on the end.
Well, I'm a veteran of the United States Navy. Out of high school, had some circumstances. My mom passed away when I was young, so I decided that I'm going to go in the military, make her proud. Had this idea of going into the military, retiring. That wasn't God's plan for my life, so I served up for one tour, and then I ended up becoming a disabled veteran, which transitioned me to coming out of the military and realizing I did not want to be an electrician's mate. And so I decided to go to school for human resource management, what I did for 17 years. And then I ended up transitioning to government employment and becoming a DVOP, which is a Disabled Veterans Program Outreach Specialist, where I get to work with my fellow veterans in arms and help them overcome significant barriers to employment, help them get job ready, and help them find employment and or training. So that is my joy now. So that's what my military service is and how I transition into the position that I am in today.
Wonderful.
Yeah, I'm a career public servant, so my dad was military. I planned on doing 20 years of military, and that didn't work out. After 5 years and active duty, with matching each year with a brand new surgery, I was on my way out medically as well. Still looking for a place to serve and serve with my veteran mates. I spent about 18 months unemployed in 2009 because the economy wasn't great, and found work in homeless services. Did that for a couple years. Got my master's degrees at the time, and moved into this role at the county. And every day is a great day because I'll do this until I retire, and I love it. So.
so I am not a veteran, but I am the daughter of a Korean War veteran. And I would say that that has to be one of the biggest motivations that I had to be able to come work at the VA. I worked in community hospitals for many years before my career brought me to the VA. And to be quite honest, had some frustration sometimes. And so I decided that I wanted to be one of those people that came to the VA and made a difference. So that's exactly why I'm there. I'm very proud to be there and will be there until the end of my career. So.
I guess I'm the oldest person on the panel. So for the people in the room, we're looking at graduated from high school, got drafted. You know, who in here ever got drafted? Nobody. The draft was prominent. Vietnam started 64, 75, congressionally mandated. So went to Germany, 24 months, came home. Started in the parts industry, worked at a few parts stores. And I'm going downtown one day and they said, jobs for veterans. went down to Tri-C. I knew a couple of people down there, and they said, hey, they got this program, Disabled Veteran Outreach Program. This is the same program Deep works with. And I said, oh, let me check this out. Got hired. This is a funded program through, this is Jimmy Carter. We're going back. This program has been around, how many years? Since 1977. It has touched the lives of thousands and thousands and thousands of veterans. This program works. It really works. I left the domiciliary working for the state of Ohio in 2018, I'm sorry, I retired 2018, 40 years of service. And I can honestly say, just dealing with the individuals that I have met, change people's lives. It's really a tremendous program. I just thank God for the opportunity that He's given me to do that. We did many things for veterans. I don't know if they still do it or not. They fixed their cars. We found them housing. I worked at 2100 downtown through Lutheran Ministries. You have a lot of drug-addicted individuals there with serious issues. I'm talking about serious issues. The domiciliary, same thing. These are homeless people who you see sometimes sleeping downtown on Ninth Street on concrete. Touch people's lives. But I just thank God that He gave me the opportunity to be here to speak to you all today. If anything any questions I can ask, or anything I can do to help you, please contact me.
Thank you. Thanks for sharing. Next question. Many veterans who have served in the war zone since 2001, which actually that's my generation, have a very high rate of service-related disability. About 41% according to research. What would you say is the largest reason for increased size in this population, and what does your organization do to meet the goals, to meet the needs of this population?
Yeah, let me take that one. So, a lot to unpack there. We ask a lot of soldiers, right? So our soldiers they are required to maintain high levels of physical fitness. They do so in a high operation tempo environments. And this generation of veterans is different than a lot of other veterans. This generation has deployed, the average soldier deployed 3 or more times versus 1 if they deployed at all in the previous several generations of veterans. So this era of veterans is more likely to experience all of that comes with a deployment, whether that the intense environments, the combat itself, the exposures and all that thing. So that explains a large amount of the increase that we're seeing in disability rates. Additionally, we're not as healthy as a population as we used to be, so that doesn't help us at all either in these factors. So that's the primary answer. To the second part of this which is what are we doing? We're helping them connect to benefits, right? We're making veterans aware of all the benefits that they're eligible for, helping them enroll in VA, connecting them with community partners and organizations like the one sitting here in this room to make sure that when a veteran does need something, that they can get access to it and that they're aware of it and that they're not afraid to engage in that service, or they're not too humble to engage, or all those other things. So we're trying to break down as many barriers as we can, like many of you are in your own programs. So that's our main role there.
Thank you. Thank you for sharing. Anyone else want to add?
I just want to say one thing. This is going back quite a few years. It really touched me. I was downtown shopping one day, and this guy, I knew he was seriously drug addicted. And I saw him downtown with his family. And it was really just to see him in that setting with his family, that really touched me to the point of knowing that we changed lives. We changed lives. To me, it was just amazing to see a person who was so drug addicted at one time to get back with his family. His children with him and everything. That changed his life. That really touched me.
I would just like to comment on the PACT Act, which many of you may be aware of, which is the largest expansion of eligibility for VA services in the history of the VA. So, when we talk about veterans serving since 2001, One of the things we think about are the exposures to burn pits and other toxins, and the VA has been very committed to screening all of our veterans for exposures to those toxins. Historically, we really just thought about Agent Orange and things for our Vietnam population, but at this point, I think the reason for a lot of the disabilities that we see are exposures to these toxins, and we want to make sure that veterans who maybe weren't eligible to come to the VA in the past, that they at least come for that toxic exposure screening so that we can determine if they have had an exposure, if they have conditions from those exposures, and be able to serve them in the VA.
Thank you. Next question. What are the risks to disabled veterans in the job and health spheres? And how does your organization provide resources or education to help lower those risks? You want to answer? Yes.
Well, some of the risks are accommodations. Sometimes you may have a veteran who has some mental health issues or needs some accommodations with wheelchair access, just different things like that. So those are some of the challenges. So we kind of work with employers to implore them to hire veterans and see what a benefit is to hire veterans. We also partner with the VA hospital in getting them the services they need so that they can get employment. We work with employers closely so that we can provide that service to let them know that, we have partnerships with or programs that can pay for certain accommodations to help them, to inspire them to hire more veterans. So those are the things that we do to try to overcome the barriers, and that's how we work with the veterans.
Thank you. You guys want to add anything?
Yeah, I just think it's important that we continue to find solutions to these barriers, right? Because these are compounding barriers, health and jobs, right? The way they play off of each other. When individuals have disabilities and they can't transport themselves someplace, or they need to work so they don't address their disability, right? Especially a young transitioning person, 31-year-old coming out of the military, they're looking to start their career. They want to impress their new employer. They're getting ready to try to put the 20-year plan together, and they don't want to take time off to go address chronic health conditions. So they let diabetes run. They do some of those other things. They figure they'll figure that out. And so I think it's important that we raise awareness amongst individuals and groups, and maybe even get into employers, utilize employee resource groups whenever we can, to try to get in there and let employers know that it's important that they have healthy veterans, not just veterans working in the workforce, and so that we can try to attack that from every angle. So.
And I believe half the battle is just information. A lot of veterans, myself included when I first got out, you just don't know what's out there, what's there to help you, and that's our job. We go on outreach, we try to touch any veteran that we can to let them know about the opportunities or program or services that are available to them, because a lot of it is just a lack of information, a lack of knowledge, and knowing what help is out there. So that's important too.
Follow up on that question. Is there any support for employers? Oftentimes, employers seek out veterans because of all the qualities they bring with them. But there, as mentioned earlier today, there may be things that are not obvious, maybe scars or things that are not obvious that to the employer. And is there ways that you educate the employer so that way we can make sure that we are actually providing the best benefit for our employee?
Yes, there are many programs, at least when I was working, I don't know if you can verify this, that offered all types of services through, they call it JTPA. These are state programs. Understand now, DNI worked for the state of Ohio. The Department of Labor funds the states. The states are responsible for employment and training of veterans. And we worked in various veteran facilities, like I said, 10 years at the federal building, Eastside, Westside Vet Center, and many of the employers and veterans. We gave them great support. We buy them books, fix their cars, did all kinds of stuff. And it's very important that you make that contact with that employer. And a lot of times they pass it on to the neighbors, to people in the community, and let them know if you got a vet right now, just say for instance, he's having car problems, how can he get to work? That's a major asset. But again, these are things that we did.
There are different programs out, opportunity tax credit.
Okay, tax
We
credit.
work with on-the-job training where the state pays for, maybe not the state, but they pay for the veteran to, like a portion of their salary to get an incentive to the employer to hire veterans or anybody for that matter. But yeah, to let them kind of test out the waters, basically to say, so that they can see that this veteran can come and do the job and they can feel comfortable in knowing that, we have this support, while we go through this process with hiring this veteran. So there's different programs. We have VRE where you can go to school, but you can also, they help disabled veterans get employment that will align with their disabilities. So it's just different programs out there that will allow the employer to get assistance or at least information or knowledge as to the benefit of hiring a veteran or just the knowledge.
Thank you.
And in a lot of cases too, a lot of vets maybe don't go to college. And they go to do a trade or something similar to that. But again, that's an asset with the benefits that we offer from the state of Ohio. There's a lot of things that they can pick up on to really further themselves so they can really get a job. It's really going to give them a serious piece of money. I mean, it's a good thing. It's a good thing. You got a vet out here that it's a great carpenter. He can make a living. He's a plumber. He doesn't necessarily have to have a college degree. But hands-on work makes good money. So it's an asset.
Thank you. Next question. What tactics did your organization use to ensure that the services were available during the COVID-19 pandemic? And how has your services changed since?
I can start with that one. So I will say that as much as we try to be prepared for the things that come along, I would definitely say that the COVID pandemic certainly threw us for a loop to begin with. And one of the reasons for that is because we really still wanted to maintain a high level of care for our veterans in all of the areas of the VA that, we offer care. That became an incredible challenge. And so I think one of the things that came from it, though, and I think a lot of folks were probably able to do this, is our telehealth programs. And so the fact that we were able to, particularly some of our vulnerable veterans in terms of their immune systems and things like that, the fact that we were able to send out iPads to them and be able to send out things so that they could have virtual appointments with us made a huge difference in being able to still see them and manage their care without exposing them coming into our facilities if they didn't have to. Particularly in regard to mental health, we continue to be able to provide mental health services and a lot of other services by telehealth. In fact, to be honest, a lot of our veterans have gotten so comfortable with this, we really have to work with them to get them to come back, in person, because a lot of times if they can talk to their physician or talk to their mental health provider from their couch, a lot of them would prefer to do that. And so now we're trying to get them to come back and see us in person because it went so well by the end of it. But I would say that expansion of those virtual services, we've been able to take away a lot from that in terms of what we provide in the future too, even when we don't have a pandemic. So in some of our rural areas, we had some issues when we were providing groups, different mental health groups and things like that for veterans who had concerns with transportation. And so some of those virtual groups continue at this point because we take the transportation issue out of it and we can still provide some of those groups and different services virtually. That's one of the great things that we learned from the COVID pandemic and how we had to adapt.
Thank you. You guys want to share?
Sure. So for as bad as COVID was, what it did is it did accelerate a lot of organizations into the forward-thinking mindset of how are we going to do things better. So we've been able to move into a lot of the digitization of our services, electronic submission portals, all of that. But another thing came out of COVID too, which is there was a lot of changes in the way our population thinks. So our veteran population, like everyone else, the workforce is different and everything else. We had to figure out what the needs of our clients were. In 2019, we did $3.5 million of emergency financial assistance on rent, utilities, and food and clothing, and 1.9 last year, right? Because that's not the needs. And so what we figured out is that we had to start tailoring services more to each individual and less of a bucket of here are the things we have and come apply and tell us which ones of those you need. Instead, now it's not new programs. We brief them that way when we ask our board for approval, but it's really open programming, right? We're really asking anybody who walks into a Veteran Service Commission office and says, we need assistance. We say, great, with what? Period. Not, here's a list and check it all off. You tell us what your needs are. Now, there'll be times where we'll meet a legal or ethical barrier that we can't overcome. And in that case, then that may not be able to help. But we're doing things we've never done before. We're doing car purchase programs and down payment assistance on vehicles. We're doing daycare assistance. That's things that we didn't do before. We consider those long-term. We did $350,000 worth of college scholarships last month. That's new. We've never done that before. So we've just had to figure out what our actual population needs are, because that changed during COVID as much as the mechanisms of service did, right? So.
Thank you. Wonderful. Very informative. In the room, we have organizations like Older Adults, People with Disabilities, a number of other community members and caregivers. What can our broad group do to better support disabled veterans in all spaces of life? Big, heavy problem.
I would say promote more organizational partnerships, streamline. I know we streamline veteran services, but focus more on streamlining the veteran services, basically making it accessible, a little bit easier for people to apply for benefits and get the assistance that they need. Because sometimes you have people who are not able to, or who are not computer savvy, who are not, knowledgeable, and just putting a group of people in place to be able to get them around that curve.
If you're an employer, the number one thing is hire a vet. That's the key. If you have a company and you're looking for people, make veterans your high priority for hiring people. There are many benefits that you're eligible for through the Fed, through the state of Ohio, incentives, dollars, monies. In a lot of cases, they buy all of the things that the veteran may need. Goes to work.
So, for a lot of people, there's a lot of veterans walking around that you don't even know are veterans, right? They're engaging in your services every day, Department of Aging, other places, because sometimes we don't ask the questions. And I encourage any provider to start asking the question. Veterans, that should be a question on every application. And then an engagement with resources. There's an abundance of resources that exist for our population at large. And then there's more for our veterans, right? And so we can protect the ability to serve the entire population of aging individuals by ensuring that the veterans that are engaged in services through our programs or through your programs are coming to see veteran service offices like ours and the VA and other places, because that will protect your resources for the next person who doesn't have another pipeline. And so I would say making sure that we're asking that question. And so, are you a veteran is maybe not the right question. We've learned this a little bit over the last couple of years too as we talk. It's, have you served in the military? Because that's the real question. Because a lot of people will say, well, I was a veteran, I didn't deploy. Well, that's not the question. And so people give themselves their own category of what type of veteran am I, and that's not the truth. Did you serve in the military? The answer is yes, and let's engage them with the right people. And there's a lot of the right people sitting to my right and left here, and you out here at the table, and community partners that we meet with every day. And so I say engage them to enroll in services, encourage them to reach out and access any one of us.
One of the things that I would just say is that we've really transitioned our way of thinking to not just serving disabled veterans, but really serving their caregivers. Because, our goal is always going to be able to have our veterans in the least restrictive environment possible. And for many of them, it means being at home. And so one of the things that we've really thought about, and some of our programs at this point, are really focused on taking care of the veteran, but also taking care of their caregiver. Because this can be very stressful for caregivers, especially caregivers who are still trying to work outside the home. We've provided some caregiver support services where we actually have been able to provide some stipends for caregivers to be able to make it financially without working outside of the home and being able to stay in the home and take care of that disabled veteran. So those kinds of programs have been more recent in the VA, but one of the things that we've learned is that we have to think about the veteran in a more holistic way, and that includes everyone that's involved with that veteran, their caregiver, their family, the people in their community, and being able to support all of them as well to be able to help us provide care to that veteran.
So, share with us some of the most interesting and underutilized services that you have.
Okay, not at all interesting, but I'm not going to miss the opportunity to plug it. So, the most underutilized resources are our hearing aid program. So, we work with an organization that provides medical grade hearing aids to veterans, not just veterans' spouses, surviving spouses, and adult dependent children. And children, so any dependent child. So if a veteran is under an income limit, and it's a pretty high threshold there, I'd give you the exact number, but I don't have the table and chart in front of me. It's not the poverty guideline, it's significantly above that. All they have to do is show that their income, show that they're a veteran, show that they live in Cuyahoga County for the last 90 days, and we'll get them. Yeah,
9 days.
90 days. 90 days, that's the Ohio law for Veteran Service Commission. So, and we'll get them screened and get them the medical grade hearing aid that is best fit for them, right? And so it's a customized solution through where we go through. The solutions we're providing are $7,000 plus hearing aids, and we provide them at no cost to the veteran or their spouse or their surviving spouse or their dependents. And so it is completely, we did $50,000 worth of hearing aids last year. There are 67,000 veterans in Cuyahoga County, plus surviving spouses and eligible dependents. I encourage you, if you know someone specifically in this group, and then let us know. Get them down to see our offices. You've probably seen us on the news in the last couple of weeks. Right now we're calling it the Race to 100. I want to do 100 hearing aids before the end of the year. I do have that room in my budget to make that happen in the next 2 months. So let's get them down there and get that done.
I have a situation, John, I mean, this is right on time for what I want to say. And I like to just suggest, a lot of, not me, but you all are younger people. You'll find that in dealing with a lot of older vets, the vet doesn't want to cooperate. You'll have a situation, they're 75, 80 years old. Dad, come on, I want you to go to the VA. I don't want to go. I want you to go down to the Veteran Service Commission. You can get a hearing aid. I don't want to go. That's a big issue with a lot of the older vets. They just don't want to cooperate with their children. How many people in here right now have experienced that? There's quite a few. This is real. This is a big issue. There's a lot of benefits that veterans, older veterans, are eligible for. They just will not go and try to get them. So I encourage everyone, keep talking to them. Whatever you got to do to get them there, get them there. I got a situation in my church right now. I talked to his daughter yesterday. The man needs a hearing aid. Seriously needs a hearing aid. Very difficult person to deal with. He doesn't want to go this, he doesn't want to go do that. I'm just glad you mentioned that. I'll mention it to the family.
I know a guy.
But again, if you have an older veteran at home who's giving you a hard time, keep talking to him, try to get him out there to get those benefits. There's a lot of things out there they're eligible for they don't get because of their stubbornness.
This might sound a little obvious, and because I'm a social worker, you might think it's the reason why I'm saying it, but we have in social work service for the Northeast Ohio VA healthcare system, we have a department of 400 staff, including about 260 social workers that work for the VA. And one of the things that I will say about social workers is that we are your navigators. We're your navigators for not just resources in the VA, but also resources in the community. And so when you talk about veterans who need to come in and they need to hear about what's available to them, please seek out the social worker wherever you are, because social workers really have the ability to not only engage veterans and our disabled and elderly population, but also communicate to them all the things that are available to them. And so wherever you are, ask for the social worker. I would say we are underutilized, and there's so many of us, and we want to be able to help connect folks with the services that are available to them.
Well, in closing, is there anything else you'd like to share with this community?
I like to say, if you are a person, I can say this, can't say it enough, dealing with any population, if you know anyone who has a company and they're hiring, or they have the ability to hire, always hire a vet. That's all I got to say.
I like to,
Go ahead, I'm sorry.
I was just gonna say, while I am a DBOT with the state of Ohio, Ohio Means Jobs, and my specific focus is working with veterans helping veterans. Ohio Means Jobs is a large umbrella. So if you have family members that are not veterans, we have adult services, youth services, senior services. So if someone's in need of help for a job or training, Ohio Means Jobs is a place to go. So send your veterans and their family members. If they need assistance, send them down to Ohio Means Jobs. We have grants, different programs, supportive services as well, and just send them on down.
1910 Carnegie.
1910 Carnegie. I have flyers on the table right there by Joe Castani.
I did have one more thing I did want to put out for the group. So on November 13th, there is a Veterans Resource Fair put on by the City of Cleveland. Can you tell me what the location is on that flyer in front of you?
Eastbrook Recreation.
Estabrook Recreation.
There we go, Estabrook Recreation Center. So encourage veterans to come and attend. Thanks.
Thank you. All right, so to the audience members, we're going to transition. If you have any questions for this esteemed panel, there are microphones that are posted. Yes.
I am a veteran's wife for 24 years. Now, my thing is that my husband is now back into the VA. And y'all talking about caregivers.
It's a patient.
Yes, he is.
Right.
And y'all talking about caregivers. But y'all not helping nobody to assist them with caregivers. I've been calling the VA, I've been calling y'all, and I have not had no response back to me. He's been in my care. As a matter of fact, y'all threw him in my care on the 17th of last month, and I'm still trying to get some help, and nobody is responding. I'm getting tired of calling. I'm getting tired of asking. Nobody is responding back to me, and it's not fair, especially when he can't walk.
So could you and I connect as soon as we're finished here? I want to make sure I get your information, and that way
I
we can
have no
address it.
problem with that.
Right.
All I ask for the DA or anybody is to help me to assist him. Because y'all put him in my care, which I have to pay his bills with his money. I have to tend to my bills with my own stuff. It's really hard on me. I can't go out and do nothing. I can't get nobody to come in to sit with the veterans. So I'm not trying to be funny, but this was must meant for me to be here to ask y'all questions because right now I need help with this young man.
Yeah. I'm happy to help. Let's talk.
All right, so we have a question, we have a, yes, take the time.
I work with services for independent living, and we work with people that have disabilities. We service the people that are in training, meaning in school, job seeking, or people that are employed. In our program, as the lady was saying that she don't have any help, we take on people and they will pay their caregiver and we reimburse the money back. So I'll give you my information and we can outreach and deal with some of the people that's in those situations. If you have a waiver, that's acceptable too. However, we do what is called a needs assessment, and our cap is 35 hours. So we will reimburse back what is paid out. And it doesn't matter whether you have a waiver or not.
Thank you. Thank you, Shannon.
We have one over here.
You can stand up, we can be seen by TV 20.
I'm with the Cuyahoga County Division of Senior Adult Services, and my colleagues are here with me, and we often get various questions from veterans and offer opportunities to make available to them benefits and services that we're able to offer through the Benefits Checkup Program, which is under the ADRN. One of the questions often that I will hear is that there are challenges for veterans when it comes to medical care, and oftentimes they'll say they go to the VA and they go for whatever need they have in terms of their medical concerns, and then they make an appointment, and then they complain that there's a high turnover of staff, so they'll make an appointment and it takes 4 months for them to get their next appointment, and then when the appointment comes, they're told the staff person is no longer there, they have to wait 4 more months to get another appointment. So I don't know if that's ever been a concern that's been shared with you all about veterans, and basically that being some of the reasons why they just don't even bother to go and be proactive about their medical care. They just give up. So I'm concerned to that respect, with that having been a question that's been addressed to me, and hopefully you all can address that as well.
I'd like to just say something. I got out of the military in 1967. That's been happening since 1967. This has been a major chronic problem with the VA's medical system. Contact your council, your congressman, contact people that have the ability to really take a look at the VA seriously. 1967. You're talking a long time, and that's a lot of veterans, and just that complaint alone times nationwide, 1 million people that have probably have the same situation that they're dealing with right now. So that's a major problem among the veteran population. Go to the hospital or you seek veteran services, and all of a sudden, oh, I'm sorry, Dr. Jones, you retired, or sister, whatever. It can get crazy. Contact the VA, contact congressman, and push the issue. That's the only way you're going to get it solved.
And go ahead.
I'm gonna take off my work hat for a minute. And I'm just gonna speak as a disabled veteran who goes to the VA hospital. I happen to have a great primary care physician. I've never had that type of experience at the VA because I do make sure that I have a good relationship with my primary care. If I do need to go to neurology or anything like that, if the VA cannot support my appointment, they give me a referral to Cleveland Clinic. So maybe who's ever going to, if they have a relationship with their primary care, or wherever their primary care is, if they don't have any immediate appointments, they have the ability to make a referral to a Cleveland Clinic or university hospitals, so you don't have to wait that long for an appointment. Also, you can talk to the ombudsman there at the at the VA hospital. They're very helpful. If you have questions or concerns like that, talk to them. Any veteran who's going to the VA hospital has a social worker assigned to them, whether they know that or not, or whether they ever go talk to them or not. Go talk to them and let them know about the issues that they're having. And I'm just speaking as a veteran now, so they're there. You just gotta go, you know, do the legwork and talk to them and make a request. I've had a situation where I needed to go to neurology and they didn't have any appointments for a couple of months. Well, that's not good for me. So I asked for a request. They give you the referral out. Once they give you the referral out, the VA covers it and you go see the doctor and you're taken care of. They report the findings back to the VA, but utilize the people there, the services, the social workers, the ombudsman, just, you know, the congressman, Dan, you can make that your last option, but just try to infiltrate through the VA because there are people there to help you. And I'm not saying these situations doesn't exist, but I am saying that there is a resolve. And it's a lack of information because they don't know what to do, unfortunately. So maybe tell them that. Now I'm putting my other hat back on.
Just to piggyback off of that, I think me being the older vet, I've had the older experience. I'm a Vietnam vet. And for those who don't know, Vietnam vets were really treated horribly when we came out. Yes. So at this point, I'm going back to it. And I told my wife specifically, I've worked, I have medical care. And this is real. The last place you take me is the VA hospital. Amen. So right now, that's fixed in my heart. I'm to the point now where and right now I'm in pretty good shape. But once you get treated that way for a period of time, you say, hey, let me go somewhere else. And it's worked okay for me. But again, the congressman piece, those are some things a lot of people need to do is contact their congressmen. There's a lot of things that need to get done. We all know that the only way you can get it done is through the system.
Yeah, I just wanted to say that when those issues are coming up, please direct them to the patient advocates at the VA. So every VA clinic and also at Wade Park, there are patient advocates that are specifically there to work on these kinds of issues. So if they contact Wade Park, they should be asking for a patient advocate or at the clinic where they go. And they'll be able to work with them on the issues that you described.
And one thing I'd like to say on this subject, and of course, you guys are going to learn, I'd like to say something on everything, is the VA is the largest medical center in the world. Hands down, it is just big. And so you are going to hear stories, and they're going to be compounded. There's 22 million veterans engaging in a very big system. And so trust the local level. We can't fix the whole system. But at the local level, your local leadership has a lot of control. So the patient advocates, they will speak to the director, they'll run it through their chains, and things can get fixed at that level. These aren't issues that don't happen in the other sectors either. That's the one other thing that from VA healthcare, that generally speaking is a reality, which is we expect perfection. Like, I'm at the VA because when I got out, I was going to the VA, I thought to put my personal hat on. I thought I could get better care in the community. So I went out to the community and it was worse than the VA here. So I went back, and that was through the clinic. Like, I wasn't happy with my healthcare. What I realized is I was a bad patient. I wasn't doing the things I was supposed to. I wasn't willing to follow orders. I was stubborn and wanted the things I wanted my way, not the way that made sense for my health, until I decided to address it and listen to it the right way. So, and sometimes that is the case. And I'm not saying that there aren't cases where the veterans are getting bad services, but it happens everywhere. And that doesn't make it right. But there are mechanisms in the VA, because they do recognize that perfection is expected, that there is a lot more controls to fix action at a local level than there are at your primary care doctor in Westlake. That's just the way, that's just the reality of it. So engage in those services, reach out to the social work team, they're amazing, and reach out to those individuals and the patient advocates, and encourage the veteran to engage and ask questions instead of just taking that rescheduling call personally. They'll just reschedule it, they'll get you in quickly, and if you tell them how important it is to you, they'll get it even quicker. The veterans just got to advocate on their own behalf sometimes, instead of just taking it. And we tell them that all the time. We experience all the time. You got to advocate on your own behalf. You have to let people know how important it is to you that you want something.
We have time for about one more question.
We got it for you. You have a question? Stand up.
How have your life changed from having a disability?
That is such a great question. How has your life changed from having a disability?
Well, okay. I guess I'll answer
I
that.
bet there's 3 at the table.
Yeah. So, okay, let's see. Well, if you look at me, when I walked into the room, as I walked up to this panel, you probably wouldn't think that I was a disabled veteran now, because I don't look like it. However, things happen when I was in the military, from mental and physical, that caused me to have to live life differently. You know, I've had to have brain surgery. My face is numb from here to here. Some days I get up, I just don't feel well. I just press on. Like, if I don't feel good, I don't feel good. If I'm having some breakdown or some mental health stuff and I just feel like I can't do it today, I take a break. But mostly I just keep pushing through. So to answer your question, is just I just keep living. And so that's how my life has changed. Some days I have good days, some days I have bad days. Does that answer your question?
Would anybody else like to share?
No better answer than that.
Well, I'd like to thank you. I'd like to thank you for this panel. This has been a wonderful, informative day. Thank you for sharing your experiences. Thank you for sharing some of the service that your organization provide. And it's been a great afternoon of enlightenment. And thank you for your service and all you do for your community, and you will continue to do. Thanks.
Thank you.
John mentioned that the city of Cleveland is hosting a Veterans Resource Fair, and Edwin Paris, who's the city's representative and liaison in community relations for Veterans Fairs, is handing out a flyer. So we'd really love to fill the house at Estabrook. Estabrook is a city resource and recreation center in the Old Brooklyn neighborhood and pretty close to the zoo. Lots of resources will be there, and we hope you will be too. Speaking of resources, on your table, you've got an orange bag with our phone number on it, so a plug for the Department of Aging. Also, resources out at the table. There's something from the Western Reserve Area Agency on Aging. But the city has a new resource that I just want to invite my colleague Adam to come up and talk about. You've seen the swag at your desk where you're sitting for 311. And if you can just give us a couple of minutes, we want to do a little plug for 311. So Adam?
Hey, good afternoon, everybody. Thank you for your attention. Just happy to share something new with you guys. The city has relaunched a 311 service. If you've been around for a while, you might be familiar with it already, but it is being relaunched. But in case you're not familiar, 311 is a centralized non-emergency hotline for sort of all things city services in Cleveland. So if it's an emergency, you know, could dial 911, something like that. But if you're trying to access city services, oftentimes we know that folks, they don't know exactly who to call or where to go to get a hold of somebody. And so if you can call 311, that would be an awesome way to get a live person. It's a 24/7 hotline. It's a 24/7 hotline. And so if you want to give us a call, there's also a new website too. And that is one of the big parts of what we've launched is this new website. And so if you go to the city's website to 311, you can log in there. Thank you, Mara. You can log in there or give us a call 24/7. It's available 365 days a year. Things you can do, I need to get a hold of the Department of Aging. I don't know the number. You can call 311. I saw a pothole and I want to report it. I can call 311. There's a downed tree after those tornadoes we had come through town recently. You can call 311 and notify us. So this is just an excellent way to notify us. And if you do the website, you can create an account and get like updates on your report too. So you can see the progress, what's happening, and know when it's been addressed. So a lot of people kind of wonder who this is for. And I'm saying it's for anybody. Anyone who lives in, visits, works in the city of Cleveland. Anyone who just touches the city of Cleveland can benefit from 311 and just being able to access our services better and more easily. And so I hope you guys check out the website or give us a call if you have any questions with 311. So we got some new swag there. Please take that back with you. Share it with your friends, your colleagues, anyone who touches the city of Cleveland, please. So thank you guys very much.
Thank you, Adam. As we come to a close here, we'll leave a few minutes at the end where we hope you will make connections with each other. We hope you heard something from our panelists that you could take back to your personal life, your professional life. I know I'm going to go back and change our intake form to the question, have you served in the military, versus the veterans question. So thank you for that simple change we can make to better include all people. Speaking of veterans, I would not want to end this without recognizing those who've served. So if you're able and you served, could you please stand so we could thank you for your service? Thank you very much. For those that haven't seen this view that I'm seeing from here, before you leave, make sure you face downtown. It's a beautiful view of our downtown skyline that Benjamin Rose has here. And also, as I know many of you said you hadn't been to Benjamin Rose before, so please take some of their literature as you're leaving. This room is available for rent, but they're out in the community. Just today I was talking with the Benjamin Rose Center that operates at one of our city recreation centers, Gunning. They operate representing Gunning here. So Benjamin Rose, as I said, has been here for more than 115 years, and we're just so proud to partner with them. So thank you again for attending, and we look forward to seeing you again soon. Take care.